All right, joining me this morning, I have Dr. Niikhil Meena from UAMS. He is a pulmonary and critical care physician, and we're going to talk about the coronavirus. And I guess first thing, as probably a lot of people are getting up this morning, maybe they're home with their kids, and maybe even some students are watching this morning. What is your #1 advice you'd give people as far as like trying to stop the spread of the coronavirus?
#1 advice would be to stay away from crowds. If you're ill, then quarantine yourself for at least 2 weeks. If you have to go out, then at least stay 3 to 6 feet away from other people, which I understand is very hard to do if you're going to a very crowded place. So certainly avoid parties. St. Patty's Day is coming up, so I would advise to have St. Patty's party at your house rather than going out
with your immediate family.
Immediate family rather.
Do you need to avoid contact with your immediate family too, or is it just inevitable? It's almost impossible.
I wouldn't say avoid contact with immediate family. That's impossible. Just make sure that your family is not going out and making unnecessary contact with other people outside in the community, because the way the healthcare system is, we're all going to get infected with the coronavirus. If we get infected over the next couple of months, hospitals and supply chain is a whole lot better going to be able to handle the caseload that we're going to have, rather than if everybody comes to us in over 2 weeks.
There are only so many beds. There are only so many rooms in a hospital. So more and more people will probably catch the coronavirus, but we don't want to inundate the hospital so quickly and so fast. So we want to slow it down. And the slower it is, better. Now, you mentioned 2 weeks trying, basically quarantining yourself. Does it really take 2 weeks to get over? Is it 2 weeks that you're contagious with it, or what?
So it is contagious over 2 weeks, and you maybe have no symptoms, that you don't even feel bad. But if you think you've had contact, or you know you have had contact, that's the best way to go. And if you feel sick, then or have fever, cough, unexplained chills, and you have been out in a party before that, then we should go from there. But I would say quarantine yourself if you're suspect. If you had exposure, for sure, but certainly if you feel ill.
If you've had exposure, should you go see your physician?
Absolutely not. You would give a phone call to your primary care physician and make sure they understand what your situation is. You got exposed, and somebody will keep an eye on you and as you stay home. And when you get sick, you can still call in and say, hey, I'm feeling sick now. What do I do next? Then there's different level of illness. If you just have a cough and cold and a fever, majority of those symptoms are going to be able to be maintained at home with over the phone or telemedicine help. Otherwise, if you feel very ill, that you have high fevers, you're short of breath, you can't walk from your bed to the bathroom, then you would still inform the emergency room that you were coming in, that you are feeling sick, and then once you get there, we will be able to contain you in a special room so that you're not contagious to other people.
Rooms too. So are those the normal symptoms? Shortness of breath, fever, aches? Is it? I mean, is it? Their symptoms like the flu itself?
So it's a viral illness. So symptoms are pretty similar to other illnesses. You will have, you can have a dry cough, fever, high fevers up to 102, 103, body aches. Shortness of breath is more at the end of the spectrum when you're very ill, but you can start having some shortness of breath. You can't do your daily stuff, daily activity living, so not that you're not walking a mile, but you won't be able to pick up your mail and whatnot. So those things would make you that you're more short of breath. Abdominal pain and diarrhea have also been associated with it, and sometimes that's the only symptom you have. So just overall the same viral kind of symptoms that we have every day. The only reason which would escalate a suspicion of coronavirus at this point would be travel and contact, and possible contact with people who have traveled, and obviously people who we cannot assure if they had a contact or not would always be suspected. But the first thing would be to stay home, let somebody know, and somebody can keep an eye on you and at your house to see if you're then getting above the infection. Once we have more testing capabilities that we are ramping up, then you can get tested, go home, and wait till your test comes back. If test is negative, then and you feel fine, you could go back in your normal routine. But since testing is taking some time, and we don't have the testing capability that we need to ramp up to a place where we can test a whole lot more people.
Oh, one more precaution you could take as Dr. Meena walked in, I did this. He said, no, let's do this instead. Greet people with your feet.
It's called the Wuhan shake.
The Wuhan shake. We'll be right back after the break.